Welcome to Dr. Bao's office. Today we explore a critical question in diabetes care. Is metabolic surgery more effective than medical therapy for treating type 2 diabetes? The debate began over 30 years ago with a groundbreaking article by Pories and colleagues suggesting that type 2 diabetes might be a surgical disease. They noted exceptional glycemic control in patients who underwent gastric bypass surgery. Since then, numerous prospective trials have demonstrated the superior effectiveness of metabolic surgery. The Stampede trial showed that metabolic surgery significantly outperformed intensive medical therapy in achieving glycemic control, reducing hemoglobin A1c, HbA1c levels, and lowering the risk of cardiovascular complications. Diabetes care costs the U.S. $412.9 billion annually, with a substantial portion due to lost productivity and chronic disability. Metabolic surgery not only improves health outcomes, but also reduces long-term healthcare costs, proving to be a cost-effective solution. In 2017, the Second Diabetes Surgery Summit recommended metabolic surgery for type 2 diabetes patients with a BMI of 30 or higher. These guidelines were reinforced in 2022 by the American Society of Metabolic and Bariatric Surgery and the International Federation of Surgery for Obesity. Multiple randomized clinical trials, including ARM-MS-T2D, have confirmed the long-term benefits of metabolic surgery. At 7-year follow-up, patients who underwent surgery showed significant improvements in HbA1c levels and higher rates of diabetes remission compared to those receiving medical therapy. However, studies on metabolic surgery for patients with lower BMI were not of sufficient duration to provide long-term data on the durability of outcomes. Therefore, we lack comprehensive data to support recommendations for bariatric/metabolic surgery in treating lower BMI patients with type 2 diabetes. Additionally, comparison studies have not provided sufficient data to evaluate the effectiveness of metabolic surgery against more recent advancements in medical treatment, such as weekly GLP-1 receptor agonists like Mounjaro or Ozempic. Despite robust evidence, metabolic surgery is underused. Major barriers include insurance coverage limitations, especially for patients with Class 1 obesity. Advocacy is essential to ensure all eligible patients receive this life-changing treatment. Both patients and providers often lack awareness of the benefits of metabolic surgery. Systematic educational efforts are needed to disseminate this knowledge through professional meetings, peer-reviewed literature, and social media. It takes an average of 17 years for research findings to be adopted in clinical practice. Patients with obesity and type 2 diabetes cannot afford to wait. We must act now to ensure access to metabolic surgery, a proven, life-extending treatment. For patients who cannot tolerate newer generation GLP-1 receptor agonists, find them ineffective, or have contraindications, bariatric surgery should be strongly considered as a viable treatment option. Thank you for watching. If you have any questions or need more information, please contact Dr. Bao's office. Although Dr. Bao is not a surgeon, he is dedicated to providing comprehensive care for his patients. If you are considering bariatric surgery and have uncontrolled diabetes with a BMI greater than 30, Dr. Bao will connect you with a qualified surgeon to discuss your options. Let's work together to provide the best care for our patients with type 2 diabetes. Let's make it happen.